I have a son that is 26 years old, and he's schizophrenic. The system that you have, I listen to all the Goody Two-Shoes show, it does not work for my son. Everyone in here is painting everything that looks so good, they're doing so well, but my son is technically in that hospital at least 4 or 5 times a month because they pump him up with pills, put him back on the streets. I need help for my son, and I'm asking you to help me to get the service I need. The police is picking him up because no one has services for him. They'll say, oh, we don't do that kind of service. I said, so you telling me if he go out there and shoot somebody, you want to lock him up? I'm telling you, my son needs services for schizophrenic. I'm tired of listening to the bureaucracy.
That emotional testimony came yesterday during that same public hearing I was talking about, held by the Connecticut Legislators' Mental Health Services Committee. The hearing prompted, obviously, by the deadly shooting in Newtown. Now, after Cherise completed her testimony, the New Haven probate judge, who routinely deals with her and her son, made this sad statement about the challenges of trying to provide services to the mentally ill.
Everyone talks about more and more. We have to make do with less and less. And every day I have less and less to offer the people who are chronically mentally ill.
That type of testimony, repeated by others present at the hearing. A mother of Sandy Hook survivor said that she tried for years to get help from some local schools and hospitals for her son. Another mother of 2 children with mental illness said that the families, they pay about $1,200 a month out of pocket for mental health services, but fear that they will soon go bankrupt as a consequence. And I want to bring in Dominic now. And Dominic, this story to you wasn't just the story in Connecticut. You have a personal connection. You've written about this as well. In fact, you did a book about your mother's struggle with schizophrenia, and the book titled No Mama's Boy. I saw you nodding when the mother was recounting the story of trying to deal with the son, and for you it was, I guess, the reverse relationship.
Well, when the mother was nodding at that hearing, she was stating the troubles that parents or loved ones of people with mental illness go through. First of all, Richard, let me just say this. The reason why I titled my book No Mama's Boy is, sadly, throughout my entire life, I never had a traditional relationship with my mother. I was raised by my aunt and raised by my grandmother. I never had a male figure in my life. My father never even signed my birth certificate. So every obstacle that you can think of in life, I've basically dealt with it in terms of my upbringing. I really thought growing up, my mother, Laverne Carter, was diagnosed as a chronic paranoid schizophrenic. Not just paranoid schizophrenic. And I didn't learn, Richard, anything about this until I got older. That's a picture right there with my aunt that raised me. That's my Aunt Inez, who was a social worker for the city of New York. And the little kid there is me. But I thought growing up that it was normal. There's my mother, and I'm there on a Easter Sunday. I really thought that it was normal, Richard, for a kid to see their mother 2 or 3 months during the year, and then she's gone. That was my circumstances. And my circumstances was that my mother, when she was not around, she was hospitalized. At the age of 16, my mother underwent electroshock therapy. She was in straitjackets. She was on Thorazine levels that you can't begin to imagine. And I knew growing up that my mother suffered from mental illness, but I didn't know the degree of it until I became almost about 40 years old and started looking back at my life. And then that's when I found all these documents from Bellevue, 620 pages from Mount Sinai. And in those documents, I read how when I was 2 years old, my mother heard voices. When you're a chronic paranoid schizophrenic, you hear voices that tell you to do things. My mother heard voices that told her to throw me out of a window. She also heard voices that told her to kill me, and she tried to do it. And she was hospitalized at Bellevue on more than one occasion for trying to do exactly that, to murder her toddler son. So I can understand what these parents are going through. And it's a huge problem in this country. We are putting a Band-Aid on a problem that requires treatment for a shotgun blast. Without the money, a psychiatrist cannot properly diagnose you in a 15-minute session once a month. It's impossible. And so with my mother...
In that 15 minutes, Dom, we could talk about is what a lot of people are really allowed, I guess, under
Yes,
Medicaid, right?
Yes, under Medicaid or under the HMO, it's not much services at all. And so, you know, with my situation with my mother, I still remember the slips when my aunt had to sign her out so she can come home for the weekend and so on. With my mother, it was an easy situation because she was hospitalized and she would get violent a lot of times. I remember when I was a little boy, she would call me on medication, and it wasn't like a regular conversation. She would say, Dominic, because of the medication that she was on. I would literally escort my mother to the park as a toddler. She wouldn't escort me. And so my mother being hospitalized, that made it a little bit easier. The problem is, Richard, when they're not hospitalized. That's the problem. Because one, you got to get them properly diagnosed. That can take 2 years. Look at the situation in Newtown. The mother knew, and the reason why she kept it quiet is because of the stigma of mental illness. No one wants to have that stigma wrapped around your family. And so then you get them private treatment. That oftentimes doesn't work. You never find a solution, and they're handed tons and tons of medication, and they're, for the most part, I'm not a doctor, the patients are okay for the most part as long as they take the medication. But then what happens once they're off the medication? And they can become very violent. I'm also a victim of childhood sexual abuse. A lot of bad things happened in my life dealing with the issue of mental illness. And I talk about it oftentimes around the country because people that are dealing with mental illness, we're hurting because we feel that there's no one there to really help. There's a system that doesn't understand, and we know that there are budget problems, but society is just giving lip service to the money that's needed to really deal with this problem.
You were telling me before, Dominic, that as bad as your situation was, it was almost fortunate because it was so bad that they could get, in this case, your mom committed for certain periods. But a lot of people in 15-minute observations can't commit the person, and then they're in the household.
That's right. And that's a huge problem. Let's say we want person X committed. Person X says, I'm not going. And if you can't commit them, Richard, when it's one of the scariest things in the world when the voices start talking to them. I can't begin to describe what it's like. My mother would go from a normal person to almost the strength of an ox. And I knew as a little boy, don't cross my mother, because when I did, if I did, it meant I was making a trip to the emergency room.
Well, Dom, who would in a hypothetical situation would take the responsibility for having your mother committed under those circumstances? You, as a boy,
Right.
weren't competent or able to do that. So who would
my
do
grandmother, remember, a Southern family from Augusta, Georgia, they had never dealt with anything like this before. As often happens with mental illness, one day my mother went to sleep and just woke up at the age of 16 and was different. And so, you know, the system committed her. And she was okay while in the system, even though there are several documented incidents when she was hospitalized, where she would hurt hospital staff and so on. But what I'm trying to say to you is that these families are dealing with hell in terms of, okay, Newtown. No one knew that he would go do something like this. But when they're on the medication, when they're off the medication, anything can happen.
There are two things going here parallel. There's the enormous power of the story Dominic tells as it affects a family. And that's enough, for me at least, to say we're not doing enough. But what comes in on the side of this is what happens when the damage that is done goes outside the family, like in Newtown. And their society at large feels endangered. And that may motivate a more humane treatment of folks, more so than mere sense that it's intolerable to let a family go through what Dominic's family went through. It's a shame that we view this as a problem more powerfully only when the worst tragedies occur while families themselves suffer.
I have a friend who runs or is part of the leadership of a treatment facility for primarily juveniles with developmental disabilities. And the vast, vast majority of the people who come in come from lower middle class to poor households. And he knows. He goes, I got them for 90 days. And then that's what the coverage will do. And I said, do you get them better? He goes, we can treat them while they're here. But we know when we send them out after 90 days, the good chance is they're going to come back through our doors, or they're going to go into juvenile facility here because they've done something wrong. He goes, but the system's built that, you know, there's only, and I guess my question's always been, is it because there's not enough money in the system? Is it the system so screwed up from a bureaucratic standpoint?
No, there's not enough money in the system. There's no real societal, the individual tragedies of individual families are relatively small. It doesn't happen to 25% of the nation. And it becomes, therefore, someone else's problem. Mm-hmm. It only becomes our problem when it reaches out and children are killed in ways that horrify everybody.
Tom, you don't think we look at mental health the same way we look at physical health?
No, not at all. Not at all. I mean, there needs to be more money in healthcare, as we've argued night after night. But and I'm one of the fortunate ones that made it. I'm one of the fortunate ones. Even though my mom, you know, and she was as much a victim as I was. It wasn't her fault, you know, of what happened. She's deceased now. But I mean, I just can't begin to describe.
The scariest thing you told me, Don? She was allowed to take in foster children.
Years later, my mother was able to take foster children. How she got past the screening, I'll never know.
Well, there's also a difference between treating people and warehousing them. Yep. I mean, in New York City, there are difficult line drawing questions here. The picture that Dominic paints is very stark, and not to in any way trivialize what Dominic said. That's an easy case for commitment.
Right.
But it's very, very simple, relatively speaking, to get somebody committed in the city of New York. What happens once they're committed? The idea of getting people committed just to warehouse them, to get them away from society and just leave them there and not treat them, that's a very appealing idea to some people. And, you know, look at the people being pushed onto subways now. You wonder, subway tracks now, which people are being warehoused and which people are being, it's rampant in the city right now. So the wrong people are being warehoused.
Thanks for sharing, Don.
Yep.
Thanks.
I feel it's an obligation on my part. So, thank you.
All right. We're going to go to a break. And when we come back, we're going to shift gears here. We're going to be talking about the High Court and Justice Scalia, talking about the Constitution in very interesting terms. Thank you, Dom. We'll be right back.